The most important thing that somebody wants to know when they come to see me is if they're going to be okay. They want to know if they're going to be all right. Nearly everyone is okay. We perform mitral valve repair with very low risk. In someone who's reasonably healthy, the risk is less than 1%. My name is Marc Gerdisch, and I'm the Chief of Cardiovascular and Thoracic Surgery at Franciscan Health in Indianapolis. I've performed in excess of 6,000 heart operations, and more than 4,000 of those have been valve operations. I became really interested in mitral valve disease when I was pretty young. I went to Paris and I spent time with Alain Carpentier, who was the father of modern mitral valve repair. And I would watch Dr. Carpentier rebuild an entire mitral valve. And I thought, this is what we're supposed to do. And I pursued that. My dad's a mechanic, and I always knew that the best way to do anything was to fix it. That became really kind of a passion for me from then on. People with mitral valve disease present in all types of scenarios. Some people have no symptoms, but still need their valves fixed. And then you have other patients who have palpitations, who have chest pain, who are short of breath. Shortness of breath is probably the most common symptom they present with. So mitral valve disease has different forms, the most common being a leaking mitral valve, so mitral valve regurgitation. When the valve is leaking or not performing well, the heart becomes overloaded, it has more volume in it all the time, and over time that enlarges the heart, and over time that damages it and leads then to permanent structural changes in the heart, which then lead to congestive heart failure. The vast majority, if not nearly all of them, can be repaired. It's super important that we address it that way because we learned early on that if we could repair a valve, we could restore a patient to a normal life curve. So in other words, if I repair your valve before your heart has any structural changes, you will live just as long as anyone else will. The approach for us evolved over a long period of time where we shifted off from a sternotomy approach down to a minimally invasive approach through a small incision on the right side of the chest between ribs. And nearly all single valve operations we do through a small incision on the side. And that's really kind of changed the experience for patients. The recovery process dramatically changed for us a few years ago when we became skilled at performing what we call cryoanalgesia. And this is a method for creating a nerve block. It allowed us to do the operation essentially without pain. So we have patients all the time now that tell us they're not hurting at all. The other thing that really changed recovery dramatically for us is what's called rigid sternal fixation, which means that we use an orthopedic process to put the bone back together, and that allows them to be active again. So for our patients, the day after they have a sternotomy, they can lift 15 pounds. They can use their arms to get out of bed, to get up and down from things. We have almost eliminated the need for post-acute care. My number one piece of advice for someone who has mitral valve disease, spend time with the surgeon, understand the philosophy of that. Mitral valve disease is almost never an emergency. It's almost always something that you can take your time and understand what you're about to experience.